I'm going to be focusing on using research to advocate for systemic change. So one of the things that we talk about in trauma-informed care is being able to predict to prepare. So I want to start with an agenda. I'm going to be talking about systems change today, moving from local to state and regional, and finally to the national level. And I've included lots of examples to hopefully inspire you and provide a range of topics for discussion. I also want to highlight that I've tried to leave time for some real discussion at the end, because I want this talk to address your concerns, your questions, and hopefully get you started on your path to changing what you want to change. So one of my mentors said, "This isn't a mystery novel. Start with the point." So my point of today's talk, recognizing that this is a talk for women in science, is that as you advocate for system change, regardless of the level that you're advocating at, science is your superpower. So why is that? Science is data. Science is questions and observations. Science is hypothesis testing. Science is collaboration. Science is writing, communication of ideas, pattern recognition, analyzing data, interpreting results. And these are skills that we have as scientists, and they're also skills that are critical to both policy and systems change. Everyone at every level wants to see data. They want to understand their system. They want a way to measure the change as they're sort of making those changes. So use that skill, use what you know to sort of create the change you want to see. So we often think about big changes, but those can take time. So it doesn't mean that we shouldn't try for big changes, but it means we should think about where we are, what power we have, what we want to accomplish, and the time frame within which we want to accomplish it, and then sort of think about how to really target our energy and our ideas. I also want to highlight that no matter where you fit into a system, you have power. I know it doesn't always feel that way, but what you're bringing, so your superpower of science, to every group that you are part of, whether it's local, regional, or national, is critical. I'm hoping that as we go through this talk, we can think about the ripples that you want to create, the small changes that will stretch out beyond your time within an organization or a group, and that you can use those ripples to guide your actions. So I want to start by really digging into how do we approach thinking about systems change. Often we think about systems change exclusively at a policy level, but institutional culture ultimately reflects programming and services. So one way of profoundly impacting a system is by changing its culture. The way you get started with that is by looking for what's missing. When I started at OHSU, there wasn't a space for women within medical school to gather and advocate for their specific needs. And so I started a branch of the American Medical Women's Association. I highlight this because it may not feel like the big system changes that we think of, but community and the spaces that communities create, moments like these to gather and talk and share wisdom and sort of come up with next steps are essential. No one does this work alone. You do work around policy and systems change within your community. Next, you need to ask, who are the stakeholders? Who's going to support the work? And who might push back and why? Think about who should be at the table. And this is a really critical step because we often, one, presume to represent voices that we've excluded from the table. And so it's critical that we pause and think about which voices are being heard, which voices are being silenced, who's not even there, and why, what's happened, what are those barriers, and what have we contributed to those barriers to make certain that everyone has their voice represented. I also want to highlight that don't run from differences of opinion. This will come up a lot in systems change. Use those differences to explore and to open up your thinking about the problem. Things are often more complex than we initially imagine. And too often we get defensive, right? It's natural and we shut down those new ideas. But considering the range of thought, the breadth of it, is critical in developing policies or programs that are accessible and then generalizable. Okay, so to get back to the stakeholders, know who they are and know what they believe. But, and this is important, I want you to give yourself the space and permission to create your own vision before fitting into existing structures. Too often we work the other way around, but I want you to think about how existing structures can fit and support your vision. Next, I want you to talk about the perceived barriers to implementation. And I've used the word perceived here purposefully. There are always barriers. No matter what you do, they're going to be there. And you can probably list the most common ones really easily if we were to sort of go around the space right now. Finances are always going to be a barrier. Resources, time, all of these are going to be common barriers. So I want you to think about what they are, and I want you to think about how you're going to overcome them with your work. Recognize that some barriers may be inflexible. You're not going to extend beyond a 24-hour day. But there are also barriers that we imagine, and they're perceived. They're barriers that have easy paths through them if we sort of think about what they represent and how to navigate them. And so don't shy away from those roadblocks. I want you to look at them. I want you to look at those roadblocks critically. And I want you to think, is this real? Is this perceived? And either way, how do I address it? How do I critically think about this problem and answer the questions raised by the barriers? Think about what's happened. What are other people doing? Are there similar programs that have worked in the past? Are there policy examples? Are there templates that you can use? People are doing this work everywhere. You rarely have to start from scratch. And I think that is a really important lesson that I hope you will take away. Look for what's out there so that you're not reinventing the wheel, so that you kind of get that jump start into the work. Use your research skills to see what other people have done, potentially at your institution, at your program, at other programs across the country. Models exist, templates exist that can be adapted to meet your needs. I also want you to think about what the ideal program looks like and start with that ideal. Yes, you may have to compromise. Yes, you may have to let an aspect go or sort of be flexible about some pieces of the project, but start with the ideal vision of what you want to accomplish and work from there. Our policies are often limited because we can't conceptualize an ideal. And I'm actually going to talk about an example of this later. Or perhaps we can't conceptualize a good enough system. So I want you to try to imagine what that ideal is, what that good enough system is, and then match the systems change, match the policies to that ideal, to going towards that ideal. And then finally, at the very beginning, as you're starting this process, I want you to consider sustainability. What do you need to do to ensure that this work, whether it is a policy or a program, is going to be there when you step away? How can you make it sustainable? What will that look like and what will it take? And as long as you're building that in from the very beginning, you have a better chance of seeing it all the way through. So I sort of want to dive in now with examples because I think, we did the big conceptual and theoretical. So I want you to have something to hold on to so that we can really think about how this works from day to day. So I'm going to start with institutional and local. And so this is a project that I've been working on with students at Oregon Health and Science University, and it's looking at gender representation and professional title use during grand rounds. So one of the things I noticed as a medical student attending grand rounds, which we do during all of our core rotations, is that there were gender differences in who was presenting. More frequently, men, it seemed, were presenting. And so we used that community that we'd created of women in medicine, and we watched every single grand rounds presentation, because they're recorded, in all of the core departments for 2 years, 2 full academic years. And what we did during that process is we documented the gender of the speaker based on pronoun use. And then we looked at how often professional titles were used. How often was someone introduced with doctor? And did that vary by gender? And we were able to show that men, regardless of career stage, were more likely to be invited as speakers at grand rounds, and were also more likely to be to have those honorary lectures, to have those honorary invited guest lectureships. And we found that title use varied by specialty. And this is what's wonderful about data. And this is the reason I really want to drill home this idea about science is your superpower. We didn't expect that difference. What did that mean? And so we got to dig in and ask why. Why is this variability? Why are there outliers where in some cases professional title use is used all of the time, and in other cases it's almost never used? And one of the things we found is that the Department of Psychiatry excelled at using professional title use. And so we reached out and we asked, what do you do? What works? And we found out that they provide a template for their speakers, the people who are going to be doing the introductions, that include the professional title. It is written out so that no one is sort of winging it in the moment. And we know from our results, because we've sort of collected and analyzed this data, that script worked, that it made a difference and compared to all of the other specialties and how often people were introduced by their title. And so what that means now is we have a recommendation that we can use. Not only do we have the data, but that data has now informed a recommendation that we can share with all of the other departments. And I want to highlight this as a way of approaching. You see a problem, you see something that you're not so sure about. You're going to gather that data around, is this real? Test your own observations, test your own perceptions of the situation, and then look for what the data points to and the potential of, here's some recommendations that may come out of this research that you can then turn around and use to change policies at a department level. So we're working now with coming up with a standardized approach for departments around looking at representation and looking around title use so that they can sort of address the disparities that we saw in terms of gender equity. Okay, so this isn't policy exactly, but since this falls under the sort of professional development aspect of today's talk, I wanted to make this point as well. You're doing the work, so make it count twice. For example, the study on gender representation at Grand Rounds, it's going to be used to advocate for increased representation of women and gender diverse individuals as Grand Round speakers at OHSU. It's going to inform scripts around title use that will hopefully lead to new departmental policies. And it's also going to be a publication. Find ways to make your work count twice, to get it out there, to inspire and support other people who are also doing the work. One of the things we're hoping to do with this as well is share our template, our IRB template, share our data collection tools so that people at every institution can do this, can leverage the information and the data so that then they can hopefully make the same changes within their institution. All right, new example. My second year of medical school, I heard a talk by Dr. Chu about how letters of recommendation and evaluations for women contained bias. She talked about all the different types of bias and the barriers that women in medicine face. It was a pretty depressing lecture. There's a lot of barriers. And what struck me about the talk is how few solutions were presented despite years and years of research. It's also important to remember that science and technology changes constantly. And so I want you to also think about what can you leverage to address the issues and the problems that you identify that come up. So I started looking for what was out there. I'm using the same process that I talked through at the very beginning. And I found some great online resources, in addition to some phenomenal qualitative studies that helped me to define, quote, rules that were really common in letters and evaluations written for women. Each of these tools, each of these studies addressed some aspects of the bias, but none of them addressed all of the different ways that it showed up in letters or in evaluations. So then, using the literature, sort of went a little bit more of a deep dive and said, what does that list of rules look like? And this is just a few of them. And the reason I started to frame them this way is rules like this are something a computer can search for. A computer can look for the presence or absence of something. Is this word there? Is this word missing? It can analyze the length of a letter. Is this shorter compared to an average that I've been pre-programmed to identify? The existing research made it easier to design a program to address and solve the problem. Okay, so confession, the computing skills almost immediately exceeded my limited and very basic Python knowledge. And so this is where it comes back to the value of a team, which is one of the reasons I talked about teamwork, collaboration, and what we learn as scientists as being one of our superpowers. I'm currently working with a team to update the rules to include bias related to race and ethnicity, because there's been a lot of new studies that we can now incorporate. The goal is to release a beta version early fall. I am taking step 2, so that is delaying things somewhat. And the next step then is to study this tool as a potential intervention, right? So thinking about how the research can get leveraged for systems change. If we can show the value of a tool like Bias Correct, then we can advocate for schools and institutions to use it when considering evaluations or letters of recommendation so that they can identify implicit bias. Maybe in the future, letter writers can use it before they submit their letters to check for their own bias and address it before writing the letter. The goal is to have tools that are easy to access and easy to use that people can find with a quick search. But so the tool isn't available yet. It should be soon. But in the meantime, I haven't let all that great research go to waste. I've been sharing the rules that I learned from the literature search with the OHSU School of Medicine's admissions committee. And so for the past several years, I've been meeting with everyone on the admissions committee about how this implicit bias shows up in letters of recommendation and evaluations so that they can start thinking critically about it without this tool. They can think about the way that the bias may come up in the letters that they're reading. Hopefully, future committees can have an easier way of immediately highlighting that bias in the letters as they evaluate them. But at least it gets us started on people thinking about how bias might be baked into the letters that they're reading. So I mentioned programming, and I want to come back to that because I think sometimes we dismiss the programming side when we're thinking so much more about like these bigger policy issues. So programming can be a fix while you're working on bigger policies. So I'm going to use the example of something I'm working on right now, which is a care pathway. Sometimes the problems we want to solve, like children with suicidal ideation that are boarding in the emergency department, they can't be solved quickly, and they're not going to be solved easily through policy. Services for children with mental health concerns are at the intersection of both state and federal policy and funding, and so it gets pretty murky in terms of working in this space for bigger changes. And this is where programming can become a local fix. So I'm currently working to create a care pathway for children and adolescents with suicidal ideation and a history of self-harm who are waiting for beds. They're either boarding in the emergency department or on an inpatient pediatric unit. And the care pathways create separate services and programming within the hospital for specific groups. So children will have schedules, access to activities and resources to help them stay active, materials to learn coping skills and dealing with stress. It's going to start sort of therapeutic support before they're getting that inpatient psychiatry bed. Staff in the different settings are going to be trained in how to best support children and families while they're on the units. And there will be materials for the parents too. So thinking about that entire community. And the time that was previously spent for kids and families just waiting can now be spent in a therapeutic way. Does it solve the bigger issue of children being forced to board in the emergency department because there are not enough beds? It absolutely does not. But the goal with this intervention is to make it better for children and families right now while we're working on solving the bigger issue. And that's what I'm getting at when I talk about thinking about those ripples. What are the small things you can do? What are the bigger things you can do? And what are the timeframes like for those different interventions, those different systems change approaches? Okay, so I want to move into thinking about state and regional. So we're going to go bigger outside of our programs or outside of our institutions. So leveraging your partners. I mentioned early on that I've been involved with the American Medical Women's Association, and they had a program called Revolution by Resolution. So they provided templates on gender equity resolutions that you could adapt and submit to your state medical boards. So in 2019, I submitted a resolution on gender equity to the Oregon Medical Association as part of this initiative, and was able to work with the Oregon Medical Association on an entire host of broad equity resolutions that were passed in 2021. And I kind of want to, I want you to think about how you can, many of us are members of professional societies. How can you use those resources, the initiatives that they're working on at a state level? Because that's really what happened here. And now I'm going to show you how I'm going to try to do the reverse for bigger change. So one of the things that I noticed as a member of the Oregon Medical Association, and that someone pointed out, is that they don't have a lot of policy on LGBTQ plus health. And so we initially worked on their JEDI task force and their committee, and they asked us, a group, to address gender affirming care. But I pointed out and said, yes, I'm happy to do the gender affirming care. I would love to take that on. And I also think it's critical that we include other aspects of health, right? We need to think more broadly and more inclusively than only framing within gender affirming care. And so I offered to lead the group to draft a host of resolutions to support healthcare professionals and patients in Oregon related to LGBTQ plus issues. So policies are important because having those policies in place within the state medical society gives them the sort of support that they need to guide their advocacy around state laws and resolutions, what they're going to support, what they're going to push back against each year. So that's where framing policies at a state level can be really critical for influencing even beyond your one organization or institution, but influencing what's happening at the legislative level of the state. So we're drafting the policy now, and we're being thoughtful about, we're drafting the policy now. And what I want to highlight with drafting policy is you need to be thoughtful about saying what is important and necessary without being overly specific. Because if you're too specific, then the resolutions become really quickly out of date. And often we want to get into that level of specificity because, science brain, love of detail. But take a step back and think about, where can I make the point in a general way that will have that flexibility, that will be sustainable? And this is really key because we want to try and find that balance. So I said, make it count twice. So the way I'm making it count twice is, once we've drafted the policies and passed them in Oregon, we're going to share those policies as templates back to the American Medical Women's Association. And they're going to use the same process that I used in 2019, except now they're going to disseminate them as part of their revolution by resolution program to state medical boards around the country, using our policies in Oregon as a template. So then states can have those resources. They don't have to start from scratch to create or adapt their own policies to support LGBTQ plus patients and healthcare professionals. All right, so I think that sort of gets us to this national point. What can we do at a national level? So I want to talk with, I've got a couple of examples here. One is this idea around commitment statement. So I co-authored a commitment statement for a national organization about how they would respond to racism, especially anti-Black racism in 2020. What we did is we drafted a list of actions to guide the organization and to create some accountability. I was seeing a lot of statements that didn't have that accountability piece tied in. The resolutions, as I was talking about just a few moments ago, were really broad and called for advocacy efforts at state, local, national level. And what I've been able to see kind of come from that is, this past spring, I was able to join a team drafting a response to a federal request for information about an upcoming environmental justice project. So because we had these accountability statements, these resolutions that were passed by the organization, they felt that they were obligated to advocate for anti-racism, specifically anti-Black racism, as it related to environmental justice. And so they were able to contribute this kind of written document to support thinking about racial justice as part of broader federal initiatives. And this is where thinking about, what policies aren't in your organization, what needs to be built in to push our organizations forward on areas of inclusion, on areas of diversity and belonging. How do you address justice? And so organizations are accountable for the work that they're doing. And a lot of times that's sitting down and writing and figuring out how, and working with the boards as well. All of these had to go through a process where they were reviewed and passed by the board. But you can write those policies. You can write the policies that you want to see guide your organization, and then work with your organization so that people agree on the work and agree on the path forward. Similarly, when COVID happened, pre-medical students were struggling. MCAT exams were being canceled. People were struggling to reschedule. There weren't spaces. People were having to cancel because of COVID. And so I co-authored a position paper on the use of the MCAT exam during the COVID-19 pandemic. It was passed by the board of AMWA, the national organization, and 11 organizations signed on to support delayed or elimination of the MCAT exam. This is the making it count twice thing. So we have a position paper, but maybe no one reads the position paper, right? You've put all the work in, but it's on a website somewhere. Who's going to go find it? So we adapted the position paper into a letter that was sent to every single medical school in the country, advocating for waiving the MCAT. 5 schools waived it, and many more programs changed their guidelines to allow delayed testing so that students didn't have to have that score before an interview. They could delay it until test dates were available and open, and then they could still matriculate. And one of the things I did, which was a little nerve-wracking, is I spoke about the barriers that low-income students face, including the MCAT, on NPR. So I went on national television and told everyone, or national radio, and told everyone I was a terrible test taker. But the point of doing this is that stories are really important. And so I'm sharing this example because it's personal, and I shared some really personal stories to try to get the message out. I struggled with the MCAT. I struggled to pay for prep courses. I struggled to take time off work to study. I struggled to pay for the travel required to take the exam. And personal stories are key in policy work because that's really where we change hearts and minds. We usually don't change hearts and minds with numbers as much as I love them, or with data. So, it's not, if you've read resolutions, it's not the fifth whereas statement that's going to get people. So one of the things I want you to think about as you're approaching systems change, as you're approaching working with policymakers or writing your own policy, is collecting stories to support the change that you want to create. The combination of stories and data is the most powerful tool that we have to successfully change systems. So sort of the last piece that I want to talk about is really what work and policy change has looked like on the federal level. So I was lucky to spend 12 weeks in DC recently learning about science policy and how scientists advise the nation. And I want to share the key things that I learned from that experience. And one of them is that you're the expert, which was really hard because I don't usually think of myself as an expert. But you have training, experiences, and perspectives that can't be acquired by reading an article. You have been in a lab, and often if you're talking with policymakers, many of them don't know what that's like. They can't imagine being in a lab. And you understand the nuance and the complexity of your science. And that's something else that people aren't necessarily going to take away from an article. And because you understand that nuance and that complexity, you can imagine different solutions based on what you know, based on the knowledge and expertise that you're bringing. And what was striking to me is that federal policy and the way that works, the knowledge behind that was frequently described as a mile wide and an inch deep. So the exact opposite of what we're doing with a PhD, right? Where we are going deep, 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 but perhaps not so wide. And what that means is that policymakers need scientists. They need people who can help them when that depth of knowledge is necessary, when they need to understand a little bit deeper in order to come up with the right solutions, in order to imagine the ideal, in order to figure out what the recommendations should be to really address the problem at hand. And one of the things that is key to understanding being effective in policy change is understanding the process. And this is true anywhere, policy change and systems change. Understanding the process and understanding the jurisdiction. How does it work and who are you working with? And who is the person that has the power to make that change that you're suggesting or recommending? So one of the things I did while I was in DC is I spent my time really trying to understand what was going on with the youth mental health crisis, wanting to understand the infrastructure, the services, the financial drivers of the crisis. I spoke with people at Medicare and Medicaid policy evaluation programs, former insurance staffers, National Institute of Mental Health, and many others across the federal government and federal agencies. And I asked a ton of questions about how people understand this topic and how people were approaching this topic. And then why they were approaching the topic the way that they were. I realized I have my own perspective, I have my own knowledge, but it was critical to understand theirs in order to have a meaningful conversation about what needed to change and why it needed to change. One of the things that stood out to me is that there was a focus on parity, which is incredibly important and needed, but it doesn't address the bed crisis. And it was interesting because people weren't thinking about the bed crisis because it was outside of the way they had framed the problem. And so having my experience as a medical student and as a researcher, I was able to say, this is something else that's going on, and this is why we need to be thinking about it. Many of the people making the policies around reimbursement, I found, were unfamiliar with the many different services and programs available for children in crisis. And it occurred to me that we usually don't publish what's working. We don't publish our ideal models. And what that meant is that the policymakers didn't have an ideal model to point to. They didn't have an idea of what it could look like or what it should look like to make a system that supports children. So one of the things I'm currently working on, and something that you can do as well, is a one-pager for policymakers about what a robust service system for children could look like. They have to be able to imagine it to create it. And this is what I mean when I say start with the ideal and then work from there. So I'm writing the one-pager because most of the policy briefs that I worked on during the fellowship or that I encountered were 1 to 2 pages congressional staff don't always have time for that deeper dive. And so it's really helpful to have that one-page summary that you can give to people and then provide the best relevant articles for their reference in case they want to do that deeper dive. Know too, as you're working to sort of with staffers potentially on legislation or bills, they need stories and data when they present on the topic. And as a scientist, as a researcher, as someone who wants to change the world, you can provide them with both. So I wanted to sort of pull everything together into a recipe for systems change because I wanted everyone to have an easy takeaway about how to approach the work, how to do it, regardless of what level you wanted to work at. So you're going to identify a question or a problem, and then you're going to need to define it in policy relevant terms or in relevant terms for the organization that you're working within or want to change. You're going to ask questions to learn about the complexity and the nuance, to bring in other perspectives and other points of view that sort of can enhance your understanding of what's going on and what needs to change, maybe even influence some of your recommendations. You're going to make sure that you're providing unique and specific findings. What should change and how should it change? And then providing specific and actionable recommendations. People want to know how to make the changes you're suggesting. And the easier you can make it, the more likely it's going to happen. Identify the jurisdiction and the stakeholders. Who needs to be involved? What do they need? What are their questions going to be? How are they thinking about this topic? And describe the cost benefit. Everything has a cost benefit. Then set priorities and explain trade-offs, because since everything has that cost benefit, there are usually going to be trade-offs. If resources are devoted to the change that you're suggesting, perhaps the resources may be lost from somewhere else. Why is that appropriate? Why is that important? And then illustrate a timeline for change. And this is key, thinking about those timelines. Is this a small change? Is this a bigger thing that I'm going to spend a couple of years on? Is this something that is going to be my life's work? And especially if you're doing it within an organization that's smaller, they need that timeline to sort of know, is it working? Is it not working? What do I need to do next? Have your metrics, implementation science. Have a way to measure what you're doing and evaluate. Is it working? Have I gotten there? Has the change happened? And then always acknowledge past efforts. I think too often we rush in to make that change without taking a moment to look at what people have done in the past and honor the work that they've done and figure out how our work could build on that instead of perhaps just completely replace it. There's community building and acknowledging past efforts, and I think it's critical. We often forget our history, and the more we can hold on to our history in the context, I think the more effective our change can be. So we often think that we don't have the power. We are taught and often believe that where we are in the hierarchies, whether they're academia or society, limit our reach, limit our power. And I want to highlight this because everything I've talked about today is something I did as a student. And students are usually kind of the lowest people in the hierarchy. So I want you to know that you have the tools. You have the tools for performing research and developing and influencing for performing research. And I want you to take away that developing and influencing policy and systems are similar. You have all of the tools that you need. You have the power that you need. And so my message to you at this point is to go out and change the world. And with that, I want to open it up to questions because I do want this to be as much of a discussion as possible.
Okay, well, thank you, Mollie. Before we jump into questions, let me do my little moderator bit here and we'll turn off the recording. So thank you everyone for tuning in to Using Research to Advocate for Systemic Change. We hope that you enjoyed the talk. We are now moving into our confidential Q&A session with our presenter. The recording will be now stopped and we will call your name to ask your questions. We have, it looks like about 18 minutes for the Q&A. So please keep your questions general rather than specific to your particular situation. So I'm stopping the recording now.